Hello, welcome, friends, and we appreciate you coming by our continuing conversation about the patient journey and how we can improve the patient's experience as they go on their journey from the symptoms and recognizing those symptoms to finding a healthcare solution. I'm Mark Stenson. I'll be your host for this video roundtable. Our sponsor is 83 Bar, a patient activation company and patient recruitment company. Our theme specifically today is listening on this patient journey. What we've heard from patients, what we need to listen for when we communicate with patients, what patient advocacy groups say, all along this path to helping find better healthcare solutions. And I'm so glad to be joined by three other experts in this category and in this field of communication to share with us their insights and their experience in patient communication. Welcome to you all.
Thank you.
Thanks,
Good to
Mark.
be here. Good to
Uh,
be here.
It's great to introduce our first guest. Our first expert is Lee Tomlinson. Now, Lee has earned the title Patient Lee, but long before he was a patient and an expert in the patient experience, he was a Hollywood studio producer. He was a television entertainment professional. Now he's a speaker and an author of a new book that's just come out, Compassion Heals. Lee, welcome to the program.
Thank you. It's an honor to be here. And given my medical history, it's an honor to be anywhere. So thank you for having me.
Yes. And as you think about not only your own patient experience, but as you consult with people, healthcare companies, hospitals about the patient experience, what is your focus and what do you feel like they need to hear?
Well, what I think they need to hear is the World Health Organization has deemed that dealing effectively with a patient's mental, emotional, and spiritual needs must be integral to a patient's treatment for the best possible outcome in the shortest period of time. The problem is 50% of Americans today report that they receive zero compassion when meeting with healthcare professionals, which means that half of all Americans are being deprived of a healing element that the World Health Organization had said must be integral. So they are not getting the best, quickest result for those 50% who don't also receive kind, caring, and compassionate interactions with their healthcare professionals. Mm-hmm. And that's what I do, is travel around the world to remind them, you must be compassionate with your patients. And in order to avoid burnout, which affects 60% of them, and way more now with COVID, you must be compassionate with yourself to stay healthy enough to be compassionate when we patients need it the most.
Mm-hmm. Well, this is an important topic. I look forward to exploring it more with you. Our next expert that I'd like to introduce is Darcy Ryan, and Darcy is the principal of FGT Health, and she's been formerly in public relations for healthcare companies, advertising communication, and also with a company, the Patient Experience Project. So she has a lot of firsthand knowledge about how patients and their healthcare professionals speak to each other and the communication channels. Darcy, what sort of things have you learned in that kind of experience about why the experience of patients and listening to them is so important?
I think that until you really understand, sort of to Lee's point, what the patient experience is like, it's hard to help them maintain their own health. And one of the biggest challenges that any patient with a chronic disease has is adherence and compliance and taking their drugs every day. And sometimes what that patient needs is motivation. And sometimes what that patient needs is to really understand what will happen if they don't take their medicine. And sometimes they just need support, or they need somebody to talk to their parents or help them find somebody who will be a partner with them and check in to see how they're doing and how they can help. But I think you'd be surprised at some of the things that keep people from being healthy, like not having a ride to the doctor. Mm-hmm. And so until you understand some of those finer points, it's really hard to help them, even if you have the right medicine.
Yes. Well, and the right medicine is one of your other previous experiences is with a pharmaceutical company, Takeda. Yep. And so we'll talk about that as we continue our conversation too.
Okay.
Well, I'll also introduce Meredith Glass. And Meredith was with the company 83 Bar that I mentioned, and she's the contact center strategy and optimization manager. Meredith, in that role, what all are you hearing from patients, and how is your center set up to have that one-on-one communication with patients?
Sure. So we're set up we work with a team of nurses in our contact center who are very well versed, very well trained, we have a very supportive coaching environment so that our nurses can actively listen to hear what those barriers are that Darcy and Lee were talking about. You know, what is preventing you? Is it that the patient can't get the diagnostics they need? Is it that they have tried 6 different medications and nothing's working, and so now they're no longer really believing or open to hearing about another option? You know, where are they really? And so our contact center really focuses on listening and empathy and really understanding what that patient needs in that moment before we move forward with a more in-depth or focused conversation. The first step is always to find out, what do you need from me right now today?
That's so good to bring it really to the present moment. Yeah.
Yeah.
Well, good. I'm looking forward to this conversation. I think overall, we want to explore, what these health-seeking consumers and patients really want to know about their condition and their treatments, how the consumers feel about their conditions, and I guess the level of interest in new options. Many are seeking new treatments. What they're relying on for information. We've all heard that there's a lot of dubious information on the internet that we have to sift through. So how do we do that? And I guess most of all, how we keep listening and how we get better at listening. So these are the topics that we'll explore. So Lee, I guess I'll come back to you to start. You mentioned that these health-seeking consumers and patients, really need a voice for compassion. Sometimes that's an outside voice, but you've also said they need to, I guess I'll call it, stand up and speak for themselves. But why does the patient work so hard to be heard in a system that is designed to treat them?
Well, if there ever was a system that ought to listen to patients, it's healthcare. And unfortunately, that's happening less and less and less every single day. Look, we're in pain. When we go to see a healthcare provider, we're always in pain. Nobody goes to the doctor. Nobody goes to a hospital for hats and horns. They go because they have a condition that needs to be treated, or they need to go check to see if they have a condition that needs to be treated. So they're scared. We're terrified. So we are literally, even in the simplest interaction, we're putting our lives into the hands of that person in front of us. And unless we have a long trusting relationship, I don't know about you, but it takes me a while before I trust being very, very open. And if that person who's asking me about my issues cuts me off, is rude, insensitive, unkind, in a hurry, that scares me. It says, you're not even here with me. You're thinking about the next patient, the last patient. I need you to focus on me so that I'm secure that in those moments you're with me, you are totally focused on me, not you, not the next, not the last, but on me. And when that happens, when I feel like I'm seen by that doctor, nurse, whatever it is, if I feel truly seen as who I am, not just an aging white male in a horrible, embarrassing gown, but a living, breathing human being, I'm willing to open up and reveal things that I wouldn't otherwise, that can have a dramatic impact on the diagnosis and the ultimate treatment.
Yes.
And if
Lee,
I feel that way, I lose fear and relax.
Yes. If I could, because you've mentioned the gown, this is not just a costume. This is not just a persona that you've developed, but rather it's a way to bring to life what you're talking about. You experience these things as a patient yourself.
Well, I've had I've been hospitalized. I have an addiction to adrenaline. So I have been hospitalized in 6 different countries. I've broken over a dozen bones. I've had my thumb pulled off. I've had plastic surgery. I've had bone grafts, skin grafts, more infections and infectious diseases than you can remotely imagine. And then 5 or 6 years ago, I went into my ENT for an allergy test. and walked out 3 hours later with a diagnosis of stage 3+ throat cancer that had spread to some lymph nodes. So needless to say, that was a whole nother medical experience. So I've spent all my life as a patient. I'm not a doctor, I'm not a nurse, I'm not any of that. But again, I had an experience at the very end of my cancer treatment where I was hospitalized that was so inhuman, so cruel, so insensitive, lacking connection, simple human courtesy and kindness, that it made me suicidal. And I would have done that if it weren't for a compassionate, kind doctor friend who came and visited and said, Lee, rather than giving up and giving in and going away, how about you fight, and if you live, spend the rest of your life seeing if you can return the rapidly disappearing presence of compassion to modern healthcare. And that's what I've been doing since.
That's quite a
We need
calling.
it
We do need it.
desperately,
Yes.
especially now. After
sure.
COVID, we've been separated so much. We are biologically designed for connection. We didn't survive as a species in the era of dinosaurs because we were the strongest. We did it because we were the kindest. We could go to our other human beings and find a commonality, which is together we might have a chance against those Tyrannosauruses. Apart, we're lunch. And the problem is that illness separates us. People get scared to be around us because they don't know how to act. And the healthcare system is caring less about us as people and more about dollars and pass-through. No offense. They saved my life more times than I care to remember. But this lack of compassion dramatically negatively impacts diagnosis, outcome, and to your point, compliance. So that connection is demanded, necessary, integral to the best outcomes for patient and provider, because they'll be a customer forever and put more money into your system. It's good customer service. Oh, and help save their life.
Yeah, so it should be good for everybody. Darcy, to pick up on Lee's point, I can't help but think of all the patients, whether they be in focus groups or disease awareness orientations of any kind that you've had a chance to interact with, that they say the same thing. I want to be heard. I don't get a chance to talk to many other people, especially if they have a rare condition.
Mm-hmm.
Where do you pick up on Lee's thought there, about where patients need to be heard?
Yeah, so I think part of the challenge is if you have a chronic disease, like if you have diabetes, you're going to talk to a doctor who treats, and if it's an endocrinologist, they may treat diabetes patients all day long. And so it's hard for you to stand out as an individual patient instead of just another patient with diabetes who's having a completely different experience. And the patient that doctor saw before you may have not been willing to exercise or do some of the self-care that would help them, which makes the physician frustrated. So I think there's a lot of back and forth frustration, and then sort of an inability to look at someone as a human and not a condition. And I honestly think that electronic health records and the whole need to be standing behind a computer and entering data and information as you're speaking depersonalizes the interaction to an extent that's very difficult to recover from. So there is this idea that if we could look at each other and say, I see that you're a human, and the doctor's a human too, right? I see that you're a human. What is it about your experience that I could do to help you be more healthy? And there's not time, and there's fatigue, and the inability to be a person.
Yes. And Meredith, you and your team, Darcy was talking about the time limitations. I think, we're down to like 7 minutes for the average office visit these days. But sometimes your nurses have conversations that can last 20, 30 minutes. What is it that the patients are telling you and your nurse team about, again, their need to be heard?
We hear a lot about what they've tried. We hear a lot about what hasn't worked, and a lot of frustration. A lot of I've been to 6 different doctors, and I still have these symptoms. And why is what you're saying going to be different? What's different here? we hear a lot of that. We hear a lot of, I've tried so many things. I think I just have to live with this. Um, and a lot of hopelessness, honestly. I have this condition, nothing's working, I don't feel good. Why, you know, it's almost like we're the last chance. Like, why would you be different?
Mm.
I've tried everything else. I'm going to talk to this stranger on the phone. Um, and at least, our nurses are there to listen and to ask the right questions. Our team is really strong at um, listening and then asking that follow-up question to say, hey, I hear you and I want to know more. I really care about what you're saying to me. And I want to know more about what that is. And let's talk about next steps. Let's talk about what you can do. But first, I need to know, where your experience is, what's going on for you,
Mm-hmm.
because that's the most important thing is what's happening for you, what you've tried. And I just hear a lot of frustration. Like, this is the first time that's happened. We've actually had patients cry, and like, no one has taken the time to have this conversation with me, and I can't even remember the last time.
Yes.
Um,
That's very helpful. Darcy, coming back to you as we turn to maybe we move up a little bit from the individual to groups. There are a lot of advocacy groups that purport and want to be a voice for patients with various conditions, right?
Mhm.
What do we hear from those groups as they try to give a foundation or more power or at least more volume to a patient's voice?
I think one of the things we hear a lot is about access to the medications they need, and really getting some strong support for medications that can get covered through insurance. They're not going to have to go through. So many people spend so much time trying to get a drug approved that they give up. So that's sort of a main concern is, and how do we make people who set policy understand what it's like to have this disease or this condition, and how these people feel, and even some of the emotional considerations that you might not have thought of. We worked with a group of patients who had allergies. And what you don't think about is, how do their parents feel when they have to send those children to school? And the children aren't really great at advocating for themselves, and they may eat something they're allergic to, and the parent isn't there. So a lot of what the advocacy groups do too is try to educate. Sometimes it's educate the educators so a child can fit in at school, his condition can be accommodated, and the parents can breathe a little easier and let go a little bit. But there is a lot of understand what I have and how it impacts my life, and please try to accommodate me. I think that's what advocacy groups are saying a lot.
Yeah. And Lee, you've had a chance to work with the other side of that, with the nurses, the nurse navigators, people who are meant to help again empower the patient, but help them work their way through the system and navigate literally and figuratively, the hurdles that they're facing. What do you hear from groups like that?
Well, I work with a lot of nurse navigators and others who are trying to help patients. Part of the issue for them is just the sheer volume of patients. And their concern is that they're not spending enough time with each patient. And I would say most patients agree that that's true. They feel somewhat rushed. But the simple fact is that if you're with a patient, and if you, as you enter that room, you stop for a moment, take a deep breath, and realize I'm stepping into a room with a unique human being with unique symptoms for them, and there's mental, physical, emotional, and spiritual pain, and I'm here to first connect with them on a human level by addressing them by their first name, whatever they like, introducing yourself, relaxing, and asking them. Just simple human courtesy will open up a patient. And the patients are saying, what they always tell me is, most of them is, They were cranky. They were short. They were mean. They didn't do what they said they were going to do. I had to wait in line for 45 minutes to get my paperwork. And that literally exacerbates the symptoms that patient is experiencing. It raises their blood pressure. It does nothing to help healing. So what I tell doctors and nurses and navigators and everything else, first, connect with this patient as a unique human being. Not just, again, as I said before, not the aging white male in 2212 with cancer and an infection. No, know a little something about them. Put it in the notes. They have a son, they have a daughter, they're in college, whatever the little things are. So the next person that comes in, as you scan that before you walk in, you can remember who they are as people. And because, well, I don't have enough time to be compassionate. Really. We show a video in many of my keynotes of a medic in Fallujah from a helmet cam whose comrade was shot in the neck, whose fellow soldier. The guy runs over without his helmet on, the medic, grabs this guy, throws him over his shoulder, runs into the evac helicopter, sets him down, and before he lets this guy go, he gives him a kiss on the forehead. The rest of it was treatment. The kiss is compassion. How long did that take? That long. You think that soldier will ever forget that moment? No. And when he gets it, his blood pressure lowers, his hope begins to grow. All sorts of positive benefits, measurable, would be, if they could have been, would be measured in him and for the better. So compassion takes a split second, and it starts with being conscious in the moment with that specific patient. Even if you're only with them for 6 or 7 minutes, you can be kind and compassionate if you're intending to be, in addition to competent.
Mm-hmm. And I guess, Meredith, I was going to ask you, picking up on, the nurses in your contact center, certainly they're educated, they're mostly RNs, they're competent, to use Lee's words. How are they adding the empathy? How are they, and how do you train that? And how do you, I guess, quality control for empathy?
Empathy is tough to train. But to speak to Lee's point really quickly, I think one of the things to do with maximizing that 6-minute or short interaction, what we train is to really listen to what the questions are, what the issues are, and then only provide the amount of information that patient needs in that moment. So it's not just a generic version of this is what you do with diabetes. It's, hey, Mark, I understand you're struggling with this aspect of diabetes. Let's talk about that. Let's talk about how to handle that in this moment in time, instead of just that generic blanket thing that feels so impersonal and so upsetting to patients. In terms of training, we really work before any of our nurses take their first phone call. They go through a series of coaching sessions where they do role play and really work with our trainers and our coaches to hone their active listening skills. Empathy is tough, right? You can't, people care or they don't care, but we can at least help them maximize and kind of channel the empathy that they do feel with active listening and with painting a picture of this is what we hear from patients with this condition, or from patients that are looking into alternatives, these kinds of things. These are things we might hear on the phone. What cues can you listen to? What questions can you ask to really personalize your conversation? And then, of course, because we are wanting to be helpful as well as just supportive, we have, talking points for different scenarios. So, if the patient says, this is what I'm struggling with, we're going to have some talking points and some tools for that nurse to be able to bring out so that it's the right information at the right time. And I think that makes all the difference.
Mm-hmm. So good.
Could I add a couple of points to that? Because that is a perfect answer. 2 other things that we recommend is, one is make sure that you, if you're in a management position, make sure that you poll, you ask, you interview your patients and find out their experience so that you know what's working and what isn't, and then you can change it. Also, we found what works is rewarding people with great care, is to acknowledge them in front of their colleagues as being models because they're so good at it. And the third thing is that we recommend is to institutions, you must emphasize self-care. Until your people are absolutely not burned out and healthy and aware and strong, they're never going to be as compassionate or competent as they can be. So you need to put policies and procedures and opportunities for self-care and emphasize it. And when you see someone who you get a report from your patients isn't being competent and compassionate, they're probably burned out because they all got into healthcare to heal the pain of others. But when they get burned out, you forget that because your own pain is too big. And compassion requires you look deeply with it inside yourself, find your own pain, and never, ever, ever take it out on a patient. That's hard stuff. But nobody said healthcare was going to be easy. Nobody gets into healthcare because it's easy.
No,
it's hard.
Starting with just getting through medical school, I think, is the first step, right?
And nursing school. And
Yes,
I mean,
exactly.
forget about it. I don't know how people do it.
Yeah.
And all the debt and all the stress and mom and dad going, oh my God, I thought you were going to be a brain surgeon, not a this, that.
Yes.
So there's pressure all over the place and it's hard.
No,
That's why I
it
can't do it. I wanted to be, but there's no way. I didn't have the brains or the stomach
to
to
do
be
it.
in healthcare. Not a chance.
Yeah. Well, Meredith, you and Lee both have mentioned this sort of training and quality control. And Darcy, I thought I would add maybe a industry prong onto this discussion because you've both worked at the healthcare companies and consulted them, from a communications role. But if we were talking to somebody at a pharmaceutical, a medical device company, a health technology company, and we said, look, what your brand people or what your clinical liaison type people need to hear about this empathy, what do you think that would be?
Well, I think it's interesting it goes back even further because you think about even the medical people and people conducting trials. A lot of them are trying to come up with what's a good study, right? And they don't even know what endpoints matter to the patient. They don't know what is the biggest problem that this disease causes for me, or the biggest emotional strain that whatever I'm going to do to get better, I want this one thing to improve or these two things to improve. And it's not always something that's measurable by a test, right? And
the laboratory marker.
Right. It's not always in your blood. Sometimes it's in your head, right?
Yes.
Yeah.
And your heart.
Exactly. And so I think understanding what's important to these patients who maybe the day before diagnosis were feeling not good, but the day after diagnosis, they're a person with that disease. And they have to live with that for a really long time. And so I think there's a lot of disease fatigue that people need to understand. I think you hear a lot, why don't they just? And it sounds so easy. And I think that's a place, like you were talking about, Meredith, that we really have to understand where is this patient in their struggle? And it might be something that you don't think about. And then again, just sort of trying to see it through their eyes and understand what parts of it might be hard versus what you think as a person. And to be honest, right, in pharmaceuticals, we're trying to sell people our drug, right? And that's not what they're looking for. They're not looking for a drug. They're looking for how they feel. And that may be part of it.
Good insight. Well, given that, I would like to share with you guys some statements. You actually can sometimes measure those emotional factors, Darcy, that you were just talking about. Or, Lee, am I getting better in my heart, meaning my soul, not just my physical health?
Yes, mental, physical, emotional, and spiritual.
Yes.
All deemed essential by the World Health Organization.
Yes. So there are some statements that often is used in market research or in measurements. I'd like to run some of these by you and have you put yourself in the shoes of the patients and tell me how you might respond. So the first statement is, taking an active role in my own healthcare is the most important factor in determining my treatment plan and quality of life. Do you think patients would agree with that?
I mean, I think it's hard to say patients as in a general sort of sense. There are patients who think that way, and then there are patients who are just so overwhelmed or don't understand what self-care for them involves. They just
Yes.
want somebody to come in and tell them what they need to do to feel better. And a lot of times they just want that to be a pill. But I think that's very, very dependent on whether they have symptoms. And if they do have symptoms, what kind of symptoms they have.
Mhm. Meredith, do you hear patients talking like this or responding that taking an active role in their own health is important?
If they do say something like that, it's usually following a statement of, I've tried everything. I'm really tired of people telling me the wrong thing. I'm finally taking control. Right? It's
Yeah.
not where people start, but it's
Mhm.
sometimes where they end.
Hmm.
Well said.
Well,
Yeah.
Thank
so,
you.
the thing, again, I keep coming back to this, is that it is true that, I mean, I have side effects 7 years later. I have to take pills every single day, a lot of them, and I hate it. But because of my intimate relationship with my oncologist, my GP, my ENT, and all of those people, because it's so kind and loving, I know that they're telling me the truth. I know they're telling me what's right for me because we've already connected as human beings. So I don't doubt them. And when they speak, I listen. And statistically, people are significantly more able and comply more fully, starting with, do they have a connection with whoever is telling them that? And that connection can be a few minutes. You can establish a relationship out of kindness in moments like that kiss I mentioned. So it really does come down to, do you have a relationship with your patients? And they do need to take care of themselves. They need to hear that. And they need to have a kind and loving relationship with the people who are treating them in order for them to want to do whatever needs to be done.
Good. Well, so if I could share one more statement, because we were just talking about medical research and clinical trials, there's a statement related to that that says, if a doctor asked me to be in a medical research study, I would feel that the doctor cares as much about what's best for me as what's best for the research. What would be your insight on patients' reaction to a statement like that?
I think that, I mean, it's interesting because I've heard from patients who were talking about should they be in a trial. And a lot of it is what kind of disease do they have? I'm going to go back to that again. But if you are at the end of your rope and your doctor is saying, well, here's a trial, this drug might help. Here's a trial, this drug might help. I think you're much more likely to think that doctor is acting in your best interest versus a chronic condition where this drug may not be much different. So I think unless the drug that you're going into a trial for is perceived as being significantly different and better than something you're on or have tried, there is a little bit of skepticism.
Mm-hmm.
It's interesting. I'm actually on a team of people at a large pharmaceutical company representing patients in the clinical trial, in all of the communications that go out to the patient, how it's conducted, how it's stated, how all of that sort of stuff. And it has been, we're changing it, so impersonal that it's like coming from Mars, and it's in very complicated language, and you must do this and you must do that. Don't forget as long as I have a doctor, a nurse, or whoever delivers that information about the suggestion, it is normally, and I've been with way too many people who've been in clinical trials, some of which were amazingly successful and some were not, and patients died. But again, the kind of relationship I have with that doctor, everything that preceded that, now we're at the clinical trial consideration stage, will set me up for how I feel about their suggestion. If I feel seen, heard, appreciated, loved, I will absolutely believe that they're suggesting it because it's in my best interest, or I wouldn't have them as a doctor. And if you have someone who makes a suggestion like that and you're not sure if they get another doctor, shame on them. That's inhumane to suggest something like that without a personal relationship and a connection as human beings.
Makes sense. And Meredith, the patients you're talking to, often the purpose is to let them know about a trial. What is their response?
So usually they're interested. They want to hear about the trial, and usually they want to take it back to their doctor and make sure that it's safe for them, make sure it makes sense for them. And their biggest concern is, how is this trial going to fit in with the big picture of my medical care? So the trials where the doctor says, nope, I'm going to talk with your team, part of the team, you're going to be safe, I care about you. Those patients feel a lot more confident to move forward than the more clinically presented ones. And I don't know the truth behind, whether the doctor in a more clinically presented trial isn't, I would like to believe that doctor is also going to, really care and take care of that patient. But the words, how that initial discussion is presented of, I care about you, I'm going to get your medical records, I'm going to make sure this makes sense, I'm going to talk to your doctor, I'm going to make sure that you're comfortable. That's the reassuring language that the patient needs to feel confident that they're going to be taken care of. Not, this study is being run by, a world-class cardiologist. That helps, but it doesn't help enough. They need to know that their whole team and them as a person, that they're going to be recognized and taken care of. So that language is really important.
It always comes down to trust. If I trust my primary, or whoever is speaking to me in the moment, if I trust them, if I get the feeling that they actually care about me as an individual human being and my condition is simply an addition to who I really am, I'm going to believe them. I'm putting my life in their hands, and that's what doctors, nurses, and everybody else, they're like gods to us. So if you connect, we will respond appropriately. If we don't connect, our fear will be increased dramatically because we don't know who to trust. That's terrifying. And that alone can lead us to, in my case, considering suicide, or in their case, just giving up. And if it's a condition that can lead to death, just giving up and dying. That's the opposite of first do no harm.
Yeah, that's what
I think it's an interesting question mark if this is quick, because you think about this level of trust that they have to have with their doctor has to be even higher because there's so much mistrust of pharmacies, of pharmaceutical companies. And so it's a really interesting combination of feelings about the people you're interacting with, and how much faith do they have to have in their doctor to overcome their doubts about the intentions potentially of the company conducting the trial.
That's so good.
Agreed.
Well, folks, I've really enjoyed this conversation. We've come to the end of our time, but I wanted to say what we've learned so much here just in this conversation about what these health-seeking, consumers, oftentimes we jump to a conclusion that they're a patient, but we've also dialed it back to, hey, I'm just somebody looking for, better health, whether they're diagnosed or not at the very beginning. We've been talking about how they feel and certainly what they want in terms of listening. My guests have been Lee Tomlinson, a speaker and author, a patient experience advocate, Darcy Ryan, the principal of FGT Health, and Meredith Glass, the contact center strategy and optimization manager for 83 Bar. I just appreciate you all so much for being on the program.
Thank you for having us.
Been an honor. Thank you.
And as we conclude, I would just love for you to give me, I'll call it the bumper sticker, but that shows my age, the tweet, the short sort of summary. What is it that we need to listen for when we talk to patients about their health? How can you summarize it for us? Darcy, could I start with you?
You can, but it won't be clever. But I think for me, the whole idea is if you've seen one patient, you've seen one patient, and really try to figure out how patients are different from each other and what this particular patient needs. And the only way to do that is to really talk and relate to them.
Great. Meredith, what would you say about listening?
Listen for the why. I really think that that's the secret is listen to the why. Why are you here? What are your biggest concerns? What do you need from me right now? What is your why for this moment?
Very helpful. And Lee, what do we need to listen for?
Well, I would be, if every time if I were a doctor or nurse or anybody else and walking into, I would remember to be kind because everybody is fighting a great battle. Sometimes it's physical, sometimes it's mental, sometimes it's emotional, sometimes it's spiritual. But the person you're about to walk in and see is in great pain or they wouldn't be there. Start with that. Recognize they're a unique human being and love them. Period.
Thank you for that summary. And thank you again, Lee Tomlinson, Darcy Ryan, Meredith Glass. Thanks for being on our program.
Thanks for having me.
And
Bye,
listeners,
everybody.
we've been talking about listening along the patient journey, what we're hearing from patients, what we can learn from advocate groups. And even now, we've expanded that to what we need to listen for with the healthcare providers themselves and the care and compassion we need to provide on both ends of that clinical conversation along the path to better healthcare. So we welcome your comments, your questions, your suggestions in the comments below, wherever you're watching this. And thanks to 83 Bar, the patient education and activation company, for sponsoring our talk. I'm Mark Stenson, and we'll see you on the next discussion.